In the United States of America, a dangerous virus is spreading like wildfire, becoming the silent harbinger of untold tragedy and loss. This is the most devastating and rapidly unfolding crisis in 30 years, a ruthless, invisible predator that spares no one, from the elderly and vulnerable to the youngest among us. Each day, the nation is gripped by a mounting sense of dread and uncertainty as this merciless contagion hunts relentlessly, leaving communities shattered and hearts heavy with fear. Every passing moment is charged with suspense and terror, turning once familiar routines into a high-stakes battle for survival, where the shadow of this virus looms over every street and home, reminding us all that no one is safe from its devastating reach. Imagine a world where a disease once nearly eradicated makes a shocking comeback, a relentless virus that creeps into our communities with an unseen, deadly force. Measles, a virus many believed was a relic of the past, is now spreading with terrifying speed. It all began with a few isolated cases, dismissed as an occasional seasonal illness, but soon the numbers exploded, turning quiet neighborhoods into battlegrounds. Measles is no ordinary virus. It is highly contagious, spreading through the tiniest droplets in the air when an infected person coughs or sneezes. In environments where vaccination rates are low, this virus can infect nearly 90% of unprotected individuals. Within days, a child's body can be overwhelmed by a high fever, persistent cough, runny nose, and a red, blotchy rash that starts on the face and rapidly covers the entire body. What many see as just a rash is the tip of an iceberg. This disease can lead to severe complications such as pneumonia, brain swelling, and even death. Recent outbreaks in Texas have sent shockwaves through communities that once felt secure. In West Texas, where vaccination rates have dropped drastically due to misinformation and growing anti-vaccine sentiments, the outbreak has reached unprecedented levels. Over 130 confirmed cases have been reported, with the true number likely far higher. In one tragic instance, an unvaccinated child lost their life, a stark reminder of what happens when prevention is neglected. Hospitals are overwhelmed, doctors are working around the clock, and entire communities live in constant fear as the virus silently infiltrates schools, homes, and public spaces. The danger of measles lies not only in its immediate health impacts, but also in its potential ripple effects. When a virus like this spreads unchecked, it disrupts the local economy. Healthcare systems become strained, resources are diverted to emergency responses, and productivity takes a significant hit. Parents miss work to care for sick children, schools are forced to close, and businesses suffer due to reduced consumer confidence. The economic fallout can be severe, rippling across entire regions and burdening public finances with increased healthcare costs and lost wages. But there is a powerful tool against this invisible enemy, the measles vaccine. The MMR vaccine, which protects against measles, mumps, and rubella, is remarkably effective, with studies showing up to 97% efficacy when administered on schedule. Despite this, misinformation and unfounded fears have led many to reject vaccination, leaving communities vulnerable. In areas with low vaccination rates, the virus finds fertile ground, turning preventable disease into a public health crisis. Experts warn that if vaccination efforts do not intensify, measles could continue to resurge, leading to more tragic losses and even larger economic disruption. As we watch this outbreak unfold, we must ask ourselves, how did a disease we thought was under control reclaim its deadly power? The answer lies in our collective choices. When communities stop vaccinating, they not only endanger themselves, but also create a ripple effect that threatens public health on a massive scale. The Texas outbreak is a stark warning that even diseases we consider ancient can come back stronger. If we let our guard down, the emotional toll is immense. Behind every statistic is a family shattered by loss, a child who never gets to grow up, parents who must bear the weight of a preventable tragedy, and communities left reeling from grief and fear. This resurgence is not just a medical crisis, it is a human crisis that challenges our sense of security and community. Today, as we face the measles outbreak, our choices matter more than ever. Science has given us the tools to protect ourselves, but these tools are only effective if we use them. Vaccination is our shield, our way to stop this virus from tearing apart our communities. The outbreak in Texas is a wake-up call, a reminder that we cannot afford to ignore the importance of immunization and accurate information. In the midst of this crisis, health officials are urging immediate action. They are ramping up vaccination campaigns, setting up emergency clinics, and working tirelessly to educate the public. Their message is clear: get vaccinated, get informed, and help stop the spread of this deadly virus before it engulfs more lives and further cripples our economy. This is more than just an outbreak. It's a battle for the future of our public health and economic stability. The resurgence of measles in Texas is a vivid demonstration of how quickly a preventable disease can turn into a nightmare. It challenges us to rethink our approach to healthcare, information, and community responsibility. The stakes are high. With each passing day, the virus gains ground, and the potential for further outbreaks grows. It is a race against time, a race to vaccinate, to educate, and to protect our communities from a threat that can no longer be ignored. The story of this measles outbreak is a story of warning and urgency. It is a call to action for every parent, every community leader, and every individual to stand up against misinformation and complacency. The future of our health, our children's lives, and even our economy depends on the decisions we make today. We are at a crossroads. Will we rise to the challenge, embracing science and taking the necessary steps to protect our communities? Or will we let this preventable disease run rampant, exacting a toll that could have been avoided? The answer lies in our hands. The time to act is now. Stay informed, get vaccinated, and spread the word. Together, we can stop measles in its tracks and ensure a safer, healthier future for everyone. Subscribe now for more updates on this unfolding crisis. Your awareness and action could be the key to preventing the next outbreak. Keep your guard up. Never underestimate even the smallest illness, for what seems minor can swiftly become a full-blown threat before you know it. In these uncertain times, every symptom is a potential warning sign, and immediate consultation with a doctor isn't just advised, it's essential. Regular checkups can mean the difference between early detection and unforeseen disaster. So take your health seriously, stay vigilant, and keep safe at home. Arm yourself with masks and gloves as a shield against the invisible dangers that surround us. Thank you for watching these informative videos. Subscribe now for more crucial updates. Stay safe and goodbye.